You're 18 years old, sitting in a dentist's office, staring at the ceiling while some guy in a white coat scrapes metal across your teeth. And you think, this guy probably makes $200,000 a year. Nice hours. No emergencies at 3 a.m. No one dying on the table. He fills cavities, whitens teeth, and goes home at 5. That's the dream. That's easy money. So you go home and Google dentist salary. And there it is. Median pay, $191,000 a year. Top earners, over $239,000. Job growth, steady. You look around your room, look at your life, and think, I'm going to be a dentist. Your parents love it. Your friends think it's smart. It's basically being a doctor, but without the blood and the death and the 36-hour shifts. What could go wrong? Everything. Everything could go wrong. First, you need to get in. Dental school is one of the most competitive programs in the country. You need a bachelor's degree, that's 4 years. Then you take the DAT, the dental version of the MCAT. You study 4 months. You volunteer at clinics. You shadow dentists. You beg for recommendation letters. And after all that, you apply and hope. Because the average acceptance rate at U.S. dental schools hovers around 55%. Nearly half of all applicants don't get in. But you do. You made it. Welcome to dental school. Here's your reward. Crippling anxiety and the most expensive education in America. That's not an exaggeration. The average dental school graduate in the class of 2024 left with $312,700 in student loan debt. $312,000. That's more than the average doctor, more than the average lawyer. Dentists carry some of the highest educational debt of any profession in the United States. And over a third of graduates owe more than $300,000. Some, especially at schools like NYU, walk out owing $600,000 to $700,000 for a degree in teeth. And the interest? Federal Grad Plus loans currently charge around 9%. So while you're in school not earning a cent, your debt is growing by tens of thousands of dollars a year. By the time you graduate, you don't just owe what you borrowed. You owe what you borrowed plus a luxury car's worth of interest. But fine, you're going to make it back, right? $191,000 a year. Easy. Not so fast. That $191,000 is the median for established dentists. When you graduate, you're not established. You're nobody. The average entry-level dentist makes about $120,000 to $130,000, which sounds great until you subtract taxes. You're down to maybe $85,000 to $95,000 take home. Then subtract your loan payments. If you're aggressively paying down $312,000 at 9% interest, you're looking at $3,500 to $5,000 a month in loan payments alone. That's $42,000 to $60,000 a year, gone, before you pay rent, buy food, or do anything that resembles living. So for the first several years of your career, after 8 years of higher education, you're functionally making what a mid-level office manager makes. Except the office manager doesn't. Wake up at night doing math about compound interest. Oh, and if you want to own your own practice, that used to be the dream. Hang your shingle, be your own boss. But starting a dental practice in 2024 costs between $500,000 and $750,000. Equipment, chairs, x-ray machines, lease, staff, software, insurance. You're already $300,000 in debt from school, and now the bank wants to loan you another $500,000. You're 30 years old and you owe $1 million for teeth. But let's say you survive the money part. You get a job or you buy a practice and you start seeing patients. Now you get to experience the part nobody warned you about, the actual work. Every single day, you sit in a room roughly the size of a large closet. No windows. Fluorescent lights buzzing overhead. You lean over a reclined human being and stare into their open mouth for 8 to 10 hours. Your hands are inside someone's face, navigating a space the size of a small fist, using instruments that can slip, cut, and drill. One wrong move, and you've hit a nerve, cracked a tooth, or punctured something that shouldn't be punctured. Your posture is a crime against the human skeleton. You hunch, you twist, you hold your arms up at angles your body was never designed to maintain for hours at a time. A study found that 79% of dental students, not even practicing dentists yet, students, reported neck or back pain. Among practicing dentists, musculoskeletal disorders are the #1 cause of premature retirement, responsible for 29.5% of early career endings. Your body breaks down, not from an accident, from the position. Decades of leaning over mouths in a tiny room destroys you from the inside out. And then there's the chemical exposure. You work with mercury from amalgam fillings. Dentists have been shown to carry higher urinary mercury levels than the general population. You're chronically exposed to nitrous oxide, which in poorly ventilated offices can exceed safe limits by 40 times. Long-term exposure has been linked to neurological symptoms, numbness, infertility, and spontaneous abortion. You breathe this in while your patient relaxes. But the physical toll isn't even the worst part. The worst part is the loneliness. Dentistry is one of the most isolated professions in healthcare. Most dentists work in solo or small group practices. You don't have a team of nurses, residents, and colleagues walking the halls. It's you, maybe a hygienist, a receptionist, and 15 patients, who'd rather be literally anywhere else. The CDC lists social isolation as one of the primary risk factors for suicide. And guess which healthcare profession has historically held the highest suicide rate? Dentists. A study in the Journal of Affective Disorders found that dentists had the highest suicide rate among health professionals at 7.18%. Male dentists specifically held the highest rate at 8.02%. That's not a typo. According to the ADA, 25% of dentists struggle with depression. A survey of 3,500 dentists found that 38% reported being frequently or always anxious, while 34% said they were frequently or always physically or emotionally exhausted. And 17.6% of dentists surveyed by the British Dental Association admitted they had seriously considered suicide. Why? Because think about your average day as a dentist. You wake up and go to a windowless room. You spend all day with people who hate being there. Nobody is happy to see their dentist. Nobody. The most common thing patients say to you is, "I hate the dentist," to your face as a greeting. Imagine being a chef and every customer walks in saying, "I hate food." That's your life. Every day, for 30 years. And the patients who don't hate you, they argue about the bill. They skip appointments. They don't floss and then blame you when their teeth fall apart. They leave one-star reviews because the waiting room was cold. You went to school for 8 years, you owe $300,000, and someone just gave you 1 star. On Google because you were 10 minutes late. Then there's the perfection trap. Dentistry attracts type A personalities, detail-oriented, meticulous, high standards. That's what makes a good dentist. But it's also what makes a miserable human being. Because when you're a perfectionist working inside a space the size of a tennis ball, every tiny imperfection haunts you. A filling that isn't quite right. A crown that doesn't sit perfectly. You know it's there. The patient doesn't. But you do. And it eats at you. Now add the malpractice anxiety. About 25% of dentists have been sued or have had a complaint filed against them in their career. Even if you win, the emotional toll is devastating. And unlike doctors who have hospital systems and legal teams behind them, many dentists in solo practice are on their own. You're the business owner, the clinician, the HR department, and the defendant. All at once. Oh, and those nice hours? The no nights, no weekends selling point? Partly true. Most dentists work around 36 hours a week with patients. But then there's the business side. Billing, insurance claims, staff management, equipment maintenance, continuing education requirements, marketing. If you own a practice, you're not just a dentist, you're a small business owner with a drill. And the total hours add up fast. Years go by, your back hurts. Your neck is stiff. Your hands tingle sometimes. You're not sure if it's the vibration from the handpiece or early nerve damage. You've gained weight because you eat lunch in 5 minutes between patients. The debt is shrinking slowly. The money is good now, finally. But somewhere between the 10,000th filling and the 2,000th patient who told you they hate being here, you lost something. The excitement, the purpose, the feeling that this was worth it. And then one Saturday morning, your son is sitting at the breakfast table, swinging his legs, eating cereal. He looks up at you and says, "Dad, I want to be a dentist when I grow up, just like you." And you freeze, because you remember being that kid. You remember sitting in that chair, looking at the ceiling, thinking this was easy money, thinking this was the smart choice, thinking nobody told you the truth. and you want to say, please, pick anything else. But you don't, because you're a dentist, and dentists don't complain. They just smile. So you smile, and you say, that's great, buddy. And the cycle continues. Thanks for watching. If you've got an idea for the next career I should expose, drop it in the comments. I actually read them. But before you go, you need to check out this next video. Click on screen now, and I'll see you over there.